Hi, I'm Dr. Bill Adams, and this is No Spin Live, everybody's favorite show where you hear about hot topics in plastic surgery from the world's top plastic surgeons. So with us today, we've got Jason Posner from Boca Raton, Florida. We've got another Floridian, Jason Cooper from Jupiter, Florida. And last but not least, we have Steve Teitelbaum from LA, Los Angeles, California. How you guys doing?
All right.
Great.
All right, so let's move to this story that just came out. It's called Plastic Surgery, a Gift Not Geared for Young People. What did you think about this?
I think I agree with you. This was a stupid story. You know, we talk about these slow news days where people come up with these horrible stories to fill the network of the internet. It's ridiculous. Now, if you look at data from the American Society for Aesthetic Plastic Surgery, surgery in patients under age 18 is limited. It's not a big deal in our society. It's not a big deal in any of our cosmetic surgery worlds. So usually people with real issues, a woman with a cup on one side, a D on the other, or a big hump on their nose, or really some genetically induced issue that they're trying to take care of. And they're brought by parents who are scared for their kids to have surgery, who are supportive to them. And I don't see a lot of frivolous things coming in my door in younger patients.
Most plastic surgeons, at least the credible ones, are certainly not doing tummy tucks or breast augmentations on 13-year-old girls. But we do see some young patients. So what are your thoughts on this, Jason?
My thoughts are, it's a conversation. You talk to the patient. They're not a grown-up, but they're a young person. And you listen to what they have to say. You try to understand their insight to what the problem is. You see it as a plastic surgeon. You recognize the problem. You share the risks and benefits of the procedure. And you identify whether or not the person is a good candidate to have a procedure based on what it is that they want to do and what the deformity or defect looks like. I just don't understand the genesis of this article and why it's so, in my opinion, so unnecessarily negative about surgery. It's just not what my experience has been as a plastic surgeon with surgery on young people.
Cosmetic surgery in women under 18 is a baloney topic. We're separating all the things that the other two Jasons talked about. People who have a nasal deformity, who have a breast developmental deformity, who have a deformity of their ears. Nobody's arguing about that. The subject here is the lurid subject of the breast augmentation, high school graduation present. That's what all this is about. And it almost doesn't occur. It certainly doesn't occur in numbers that's worth talking about. These stories come out because plastic surgeons are hungry to get media, and the media wants the most tawdry stories. So whether it's husband and wife plastic surgery or Christmas gift plastic surgery or Valentine's Day, it's all a bunch of nonsense. And it's all promulgated by plastic surgeons who want some press.
This article, I think you guys have debunked it pretty well, and I think it probably is, as Steve Teitelbaum says, more somebody's marketing ploy, or a reporter wants to have a sensationalized story.